Over the last half-century, for the CEOs and senior managers of healthcare organizations, the meaning of leadership has gone through two transformations. In the kinder, gentler past, financial pressures were mild and quality was considered unmeasurable. In the absence of compelling metrics for output or pressures to contain costs, business success depended on preserving relationships, brand building, and crisis management, and these were the skills prized in healthcare leaders. The surge in medical progress that began in the 1960s, which resulted from increased investments in research in the years after World War II, drove the first transformation away from this status quo. Untreatable diseases became treatable, and some even became curable. For example, innovations like coronary artery bypass graft surgery, coronary angioplasty, thrombolysis, and statins for cholesterol reduction transformed cardiology from a passive to an active discipline. Almost every area of medicine had analogous advances. Before these advances, medicine had been a field in which physicians made diagnoses, predicted prognoses, and relieved suffering. But now, healthcare providers could actually change the future, often for the better, and sometimes for the worse. There were many more medications and operations that might help patients live better and longer lives. But occasionally the wrong drug was given, and procedures went awry. As medicine became more active, the safety and quality of care began to attract more attention, and healthcare leaders have had to learn the skills needed to improve them within their organizations, like measuring data and organizing personnel to reliably perform at their best. And it turns out that improving care is different work from keeping the peace. Leaders must be willing to enter into conflicts and manage them well. They must excel at negotiation. Simultaneously, they must have empathy for their patients, and, as in any business sector, they must deploy emotional intelligence to broker good relationships with their personnel. That work is especially complex with physicians and nurses, who are rightly proud of their professional standing and the quality of their work. The second transformation in healthcare leadership has come in response to the other side of the equation from patient outcomes: costs. Healthcare spending rose about 2.5% per year faster than the growth of the rest of the economy after 1970, accounting for an increasing share of the U.S. economy. The federal government started to try to apply the brakes on spending with the Balanced Budget Act of 1997, which cut payments to doctors and hospitals. For a time, providers were able to get increases from commercial insurers that made up for the lower payment rates for Medicare and Medicaid payments, but those times have come to an end. Instead, leaders must learn to make the difficult strategic decisions and to understand the efficiency of the operations behind them in order to contain costs. These two transformations mean that today's healthcare CEOs and C-suite teams face pressures to improve quality and costs.